Here at Orange Coast Memorial Medical Center in Southern California, the big challenge was always communication for everybody, until a Tennessee company came around and served up the perfect solution.
Before PerfectServe, it was a little chaotic.
For clinical nurse Tim Horttor, playing phone tag with a doctor meant less time he could tend to a patient. And he wasn't alone. Hundreds of healthcare organizations across the country face the same problem every day.
Every nurse had to remember the doctor's idiosyncrasies. It was a lot of calling and getting a call service or a phone bank, and then, either having to be transferred or waiting for a call back.
But about 3 years ago, in came PerfectServe, a Knoxville-based secure communications and collaboration company that built a comprehensive platform with a mobile app to streamline the process. The idea hatched when Penny Edwards told her husband, Terry, about the frustrations she was having as a nurse, and Terry started the company.
I just saw all this, bouncing around and delays and messages secondhand, and I thought there's got to be some way to bring this interactive voice messaging technology to bear to solve this problem.
Edwards calls PerfectServe a holistic approach to solving communication challenges. The company comes into health systems and medical groups and figures out what their communication needs are. Then those variables are built into algorithms and customized for the specific group, like pediatricians or cardiologists. And it's also tailored to how, when, and where each doctor works.
And that allows them to receive the communications that they're supposed to receive when they're supposed to receive it, and only the things that are pertinent.
After Orange Coast adopted PerfectServe, they did a survey on their communication cycle time. Turns out they cut that time down from an average of 45 minutes to 15 minutes. And there have been other more immediate effects. PerfectServe says reducing communication process waste was a key factor in improving the rapid diagnosis and treatment of patients with acute ischemic stroke in a Detroit hospital. That enabled them to administer TPA to 3 times more patients, serving them when they needed the most immediate help. While aiming to keep Orange Coast Memorial on the forefront of innovative technology solutions and process improvement, IT Executive Director Scott Raymond reached out to PerfectServe. He says getting the doctors on board was a lot easier when they found out the system allowed them to keep their contact information, their identity, so to speak, private, and that patient information is also kept secure and therefore HIPAA compliant. And then he says doctors started pressuring each other to join.
And doctors, even though they don't seem like it, they do like technology. They may not always be the best utilizers of it, but they do like it. So, once someone who's proficient at it shows them, hey, here's my app, look what I can do, put it on your phone so we can collaborate.
Dr. Stephen Schiff was one of those doctors who happily jumped in because he says he realized it gave him more control, not less.
We could build into the system for us how we wanted our calls handled. And so it was the ability to set it up and do it the way we would want it done.
PerfectServe is already in more than 100 hospitals and practices nationwide, with upwards of 75,000 individual users. Down the road, Memorial Care Health System has plans to expand PerfectServe to more of its providers and to other acute facilities based on the success at Orange Coast Memorial Medical Center. But the biggest winner, the patient.
Less time for waiting for orders, more free flow of information, everybody knowing the same information.
And with more emphasis on value-based care these days, communication is the key to care coordination, and the patient wins at the end of the day. In Fountain Valley, California, I'm Andy Roesgen,